Hello, everyone. Welcome back Monday morning. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, broadcasting live at Valley, California.
And we are talking science and technology, and a great subject we have for you today. Just great.
We're going to get you through your Monday here.
Yeah.
Cambridge researchers found that low downstream pressure in the arm can cause blood pressure cuffs to underestimate systolic readings, missing many hypertension cases. Scientists have uncovered the reason why standard cuff-based blood pressure tests often produce inaccurate results. And that always happens. Like you walk into the doctor's office and your heart starts beating and your blood pressure goes up.
I think they call that white coat syndrome.
Yeah, white coat syndrome. And identified ways to make them more precise. Improving these measurements could have a major impact on patient health. Would you like to know more?
So for everybody that's taken their blood pressure in the last 30 days, all those measurements and all those ratings are shot out the door. Go back and have it redone. Stand up, sit down, fight, stand on your head, whatever you got to do. It's just, I've heard so many things, right? No, cuffs in the wrong place.
Put an IV in you.
Don't talk. Yeah, I don't want to hear about that. All right. High blood pressure or hypertension is the leading cause of premature death worldwide and is strongly linked to heart disease, stroke, and heart attack. Yet, flaws in the most widely used method of measuring blood pressure may result in as many as 30% of hypertension cases going undetected.
Oh, not good.
Could this work the other way? Could some of their testing show that you have high blood pressure and you don't?
False positive.
Exactly. Yeah. A research team from the University of Cambridge developed a specialized experimental model to examine the physics behind these errors. Their work revealed new insights into how cuff-based blood pressure devices function and why they can misread results.
According to the researchers, a few simple adjustments could make these tests far more reliable without replacing the standard devices altogether. The findings were published in PNAS Nexus, on August 12, 2025, point to changes that could deliver more accurate readings and better outcomes for patients.
Most people have experienced the familiar process of having a blood pressure cuff wrapped around the upper arm. In the approach known as the oscillatory method, the cuff is inflated until it temporarily stops blood flow to the lower arm. The healthcare provider then listens through a stethoscope for specific tapping sounds as the cuff slowly releases pressure.
Tap. I
haven't had anybody do that to me for a long time. It's all just watching the
machine.
The machine.
You press the machine and whoop, it goes up. Yeah, they don't even do it.
They got the screen.
Probably in nursing school they do that just so they can get it down pat.
Yeah.
The measurement is taken from a. The measurement is taken from a pressure gauge connected to the cuff and is recorded as two numbers: systolic, the higher maximum pressure, and diastolic, the lower minimum pressure. A reading of 120 over 80 is generally considered to be in the ideal range.
Generally.
Okay.
Oscillatory method, quote, the oscillatory method is the gold standard, but it overestimates diastolic pressure while systolic pressure is underestimated. It says co-author Kate Bassel from Cambridge's Department of Engineering. Engineering got in there.
Okay.
Quote, we have a good understanding of why diastolic pressure is overestimated, but why systolic pressure is underestimated has been a bit of a mystery.
What is an engineer doing in the medical field? I don't get it.
You know, I feel more comfortable with an engineer than I do some of these MDs or PAs or whatever. So, but it's all good. That's just my opinion.
You pass your exams at the institute, you're good to go.
Yeah.
All right. To go. Previous non-clinical studies into measurement inaccuracy used rubber tubes that did not fully replicate how arteries collapse under cuff pressure, which masked the underestimation effect.
So maybe they're trying to cause you to have high blood pressure, so they can give you these pharmaceuticals. It's a win-win, right? Win-win for the doctor, win-win for the pharmaceuticals.
It's intriguing.
Okay.
The researchers built a simplified physical model to isolate and study the effects of downstream blood pressure. The blood pressure in the part of the arm below the cuff. When the cuff is inflated and blood flow to the lower arm is cut off, it creates a very low downstream pressure. By reproducing this condition In their experimental rig, they determined this pressure difference causes the artery to stay closed for longer while the cuff deflates, delaying the reopening and leading to an underestimation of blood pressure. Well, that sounds right.
Yeah, that sounds right. And I can see if the older you are, your
Not as
your blood
resilient.
pressure.
Yeah, those
Yeah,
arteries.
it takes a little bit more time for it to fully expand back out to normal.
Yeah.
All right. This physical mechanism, the delayed reopening due to low downstream pressure, is the likely cause of underestimation.
Mm-hmm.
A previously unidentified factor. Quote, we are currently not adjusting for this error when diagnosing or prescribing treatments, which has been estimated to lead to as many as 30% of cases of systolic hypertension being missed, said Bassel.
Instead of the rubber tubes used in earlier physical models of arteries, the Cambridge researchers used tubes that lay flat when deflated and fully closed when the cuff pressure is inflated, the key condition for reproducing the low downstream pressure observed in the body.
The researchers say that there is a range of potential solutions to this underestimation, which include raising the arm and here we go, other little deals. Raising the arm in advance of measurement, potentially producing a predictable downstream pressure, therefore predictable underestimation. This change doesn't require new devices, just a modified protocol.
So are they saying just raising your arm?
Yeah, see, I'm not.
Because they say to keep it down here still.
Keep it down, keep it relaxed, don't talk. But then
go
they
to your
have
happy
you sit
place.
down. Yeah. Ford, Chevy,
Found on road dead. I got a Ford.
I know you got to.
Yeah. However, if new devices for monitoring blood pressure are developed, they might ask for additional inputs that correlate with downstream pressure to adjust what the ideal readings might be for each individual. These may include age, BMI, or tissue characteristics.
That makes sense. The researchers are hoping to secure funding for clinical trials
to test
their findings in patients.
Send your money.
Yeah, and are looking for industrial or research partners to help refine their calibration models and validate the effect in diverse populations. Collaboration with clinicians will also be essential to implement changes to clinical practice. So again, send me more money.
So I can do these tests.
Pad the hands of the pharmaceutical companies, their drugs, and whoever these make.
Scott.
I know. Don't get me started. So better test my blood pressure. So.
All right, folks. Thanks for joining us. We'll catch you in the afternoon.
Take care, everyone. Thank you.